Have you ever been to the doctor and you're not feeling well, or you just want a thorough checkup, and they come back and tell you that everything's fine, yet probably they've only checked your CBC and CMP? These are two important tests, the complete blood count and the complete metabolic panel. And just that word complete makes it sound like it's a very complete test. And while it's a good test to do, it's a very basic test. There's a lot more that should be done to make sure that you are not just healthy now, but healthy into the future. A good quality diet, exercising, sleep, these are the pillars of good health. But to make sure that you're on the right track, doing some testing is a great thing to do. And I recommend doing these tests on a yearly basis. So let's go into the tests that you can do, and I'll tell you a little bit more about them. The first test on our list is the complete blood count, or the CBC. This is a crucial test for diagnosing immune deficiencies, different types of anemias, and assessing your red blood cell quality. This test measures hemoglobin, red cell count, mean cell volume, mean cell hemoglobin, platelets, white cell count, neutrophils, lymphocytes, monocytes, and eosinophils. So it's a very detailed testing just of your white blood cells and red blood cells. Next up is the electrolytes and kidney function test. This is part of the complete metabolic panel. This test measures things like sodium, potassium, chloride, creatinine, GFR, which is an estimation of your glomerular filtration rate. And then the liver function test measures your liver enzymes, which is a marker of liver inflammation rather than how well you detoxify. It can identify things like fatty liver and provide important insights into your overall liver health. This test includes bilirubin, ALP, GGT, ALT, and AST. They don't always include GGT though. Sometimes you've got to ask for that one extra. And also things like protein and albumin. So that's the CBC and CMP, but as part of your regular yearly checkup, I also recommend getting these things tested. You can always ask your doctor for these tests, but if they aren't doing them, you might have to look elsewhere. Either test them privately, or at Planet Naturopath, we can organize any pathology testing. The next one is what I call the iron studies. It's essential for both men and women. Women can be more likely to be iron deficient because of heavy periods, or people like vegetarians, athletes, they could be prone to iron deficiencies. Sometimes people can have excess iron or iron overload. There's a condition called hemochromatosis, and it generally affects men more than women, especially up until women start to reach menopause, and it may affect them more as well. So the iron panel includes things like iron, transferrin saturation percentage, and ferritin, which is a marker of your iron stores. I always recommend checking C-reactive protein as well, which is an inflammation marker, because sometimes ferritin could be elevated because of inflammation. And it might give you a misleading impression that you have good iron levels, but in actual fact, they're elevated because of inflammation. The next thing I recommend testing is cholesterol. When you go to your doctor, they'll often run a cholesterol panel, which will include total cholesterol, HDL, LDL, and triglycerides. And this is important to do, but there's many other tests for cardiovascular health that you can do. And how frequently you do these tests, it depends on things like your family history, genetics, diet, lifestyle. But I would also check things like homocysteine on a yearly basis. Apolipoprotein B, lipoprotein A. This just needs to be tested once in your life, because if you have high lipoprotein A, that's a genetic marker and you can't influence it through diet and lifestyle. Doesn't mean you can't do anything about it. You just need to make sure everything else is dialed in, because lipoprotein A can increase your risk of heart disease. Other important tests that you should do on a yearly basis would include things like vitamin D, A1C, glucose and insulin for blood sugar balance, and measuring pre-diabetes. This is an important one because there's so much things you can do with diet and lifestyle to prevent diabetes. So if you can identify problems early, then they've got plenty you can do about it. Other things to check would be vitamin B12 and folate. They're important for energy production, nervous system health, and also even things like keeping homocysteine levels down. I always check magnesium levels. It's an important cofactor in many body functions. Same with zinc. It's important for immune function, sexual health, and many other functions. So I always check zinc and copper together, because an imbalance in zinc and copper could also predispose people to anxiety. The next one I would check on a yearly basis, and especially if you have issues with low energy, trouble losing weight, feel the cold, they can all be symptoms of low thyroid function. Often doctors just check TSH levels, but I would also recommend checking besides TSH, your free T4, free T3, reverse T3, and the thyroid antibodies. If the antibodies come back perfect every year and there's no family history, you may not need to check these all the time. but at least get them checked at least once. And women after pregnancy should also check their thyroid antibodies. I always recommend checking sex hormones. Doctors sometimes don't check these, especially in women, because they say they fluctuate throughout the month, which is true. And it's important to know what time of your cycle you're doing the test, whether it's in the follicular phase or the luteal phase, because that helps to understand what the test results mean. But I would recommend checking LH and FSH levels, testosterone, estrogen, progesterone, sex hormone binding globulin, and DHEA levels. For anyone with chronic health issues or persistent health problems that you do the basic blood tests or the ones we've just mentioned and everything comes back fine, which sometimes it can. Sometimes you can feel really unwell and all the blood tests come back saying you're fine. Doesn't mean everything's okay though, or it doesn't mean it's all in your head. And this is where some more advanced functional medicine testing can be helpful. Things like the Dutch hormone test, which measures adrenal function in more detail, sex hormones in more detail, and some of the organic acid markers. A blood test is not very good for measuring cortisol. It just measures cortisol at one particular time of the day, and it's total cortisol. Whereas the Dutch test will measure your total cortisol over a 24-hour period, plus the changes in cortisol throughout the day. It should start off high and then gradually come down throughout the day. Other advanced testing I do include detailed stool testing. This can be either the Vibrant Wellness Gut Zoomer or the Diagnostic Solutions GI Map test. These tests measure for bacterial pathogens, parasites, viral infections, candida, as well as beneficial bacteria. And also intestinal health markers like digestive enzyme levels, inflammatory levels, leaky gut, reactions to things like gliadin, gluten. And so this can give you an overall picture of your gut health, but also the gut health can influence other aspects of your health like immune function, and it can be associated with autoimmune conditions, anxiety, skin problems. So if you're not finding answers to your health issues, sometimes doing a gut test is important. Other tests that we run are things like the SIBO breath test. These days I use a device called Food Marble or the Air 2, which is just a little breath device that you buy and you can do as many breath tests as you like. This can be better than doing a one-off test through a lab because then they just measure one test and one substrate. But sometimes bacteria respond differently to different things. So doing multiple tests, sometimes with glucose, lactulose, or inulin, can help to give you a more thorough understanding whether you have SIBO or not. Other tests that we do include the organic acids test, neural tests, mycotoxin testing for mold, environmental toxins, heavy metals. These are all what they're called stealth infections, underlying infections that can sometimes be hard to detect but can cause chronic health problems. So it's always good to start off with the regular standard blood tests, and then if everything is not right, then you can do these more advanced tests. If you need help with ordering these tests, go to planetnaturopath.com and we can ship these tests to most countries around the world, and once you get the results, we can organize a Zoom consultation to go through them. If you like this video, don't forget to like and subscribe for more health tips and information, and we'll be sending some more videos your way soon.